Hey everyone, this lesson is on the antibiotic amoxicillin, and today we're going to talk about what are the bacterial targets of amoxicillin, what is the mechanism of action of amoxicillin, and then we're also going to talk about some of the contraindications and the adverse effects of amoxicillin usage. So what is amoxicillin? Well, amoxicillin is actually one of the aminopenicillins, and it is a beta-lactam antibiotic. So like all the beta-lactam antibiotics, it actually has a beta-lactam ring. Now, what are some of the targets of amoxicillin? Well, some of the targets of amoxicillin include the gram-positive cocci, which is similar to penicillin G. Penicillin G is also a beta-lactam antibiotic. But amoxicillin has increased effectiveness against enterococci, as opposed to Pen G. Now, amoxicillin can also target gram-negative aerobes such as Salmonella, Shigella, E. coli, Proteus, and H. influenzae. And it can also have some effectiveness against anaerobes similar to penicillin G as well. And amoxicillin can also be used for Listeria monocytogene infections as well. So how does amoxicillin actually work? What is its mechanism of action? Well, first and foremost, amoxicillin is a bacteriolytic or bactericidal antibiotic, and it actually inhibits bacterial cell wall synthesis. So it actually inhibits the bacterial cell wall synthesis by binding to multiple penicillin binding proteins. So the penicillin binding proteins are important during the transpeptidation steps of peptidoglycan synthesis, and in fact amoxicillin actually inhibits the final transpeptidation step in peptidoglycan synthesis. So here's a quick schematic of what amoxicillin does. So if you were to look at a bacterial cell wall, you'd be able to see these penicillin binding proteins. Now again, amoxicillin binds to these penicillin binding proteins, and these penicillin binding proteins are critically important for the cross-linking of peptidoglycan, and specifically the final transpeptidation step. So that's why when amoxicillin is in these sites, is bound to penicillin binding proteins, the peptidoglycan is unable to cross-link, which means that the bacterial cell wall is dysfunctional, and in fact the bacteria would not be able to withstand any changes in osmotic pressure or any other stressors, which would lead to a bacteriolysis or the death of the bacteria. Now, one of the major problems with the beta-lactam antibiotics is the development of antibiotic resistance, and bacteria have developed an enzyme known as beta-lactamase, which can actually break down the antibiotic. It'll break down the beta-lactam ring of the antibiotic, making it ineffective. So we can get around this by actually supplementing the antibiotic with another agent. In this case, we utilize clavulanate or clavulanic acid, and we mix this with amoxicillin. So you might have heard of amoxiclav. And this increases the effectiveness against a variety of other bacteria as well, including methicillin-sensitive Staphylococcus aureus, so the MSSA, not MRSA, but MSSA. It also increases the effectiveness against H. influenzae as well. It increases effectiveness against Moraxella catarrhalis. So because amoxicillin actually gives us an increased effectiveness against H. influenzae, Moraxella catarrhalis, and because amoxicillin already has some antibiotic properties against strep types of bacteria, amoxiclav can be used and is regularly used during otitis media or middle ear infection. So otitis media, if it's a bacterial cause, it is most likely caused by either the three bacteria H. influenzae, Moraxella catarrhalis, or Streptococcus. So that's why we can use amoxiclav during an otitis media infection. So if we have determined that a bacteria is sensitive to amoxicillin, are there any reasons why we wouldn't use amoxicillin? So what are some of the contraindications of amoxicillin use? Well, one of the main reasons why we wouldn't use amoxicillin is just because the patient has exhibited a previous history of a serious hypersensitivity to amoxicillin or other beta-lactams. And these types of hypersensitivity could include anaphylaxis or Stevens-Johnson syndrome. So if the patient has presented previously with these types of hypersensitivity to amoxicillin or other beta-lactam antibiotics, we would not use amoxicillin. Now, what are some of the adverse reactions of amoxicillin use? Well, amoxicillin use can cause a variety of adverse reactions, including hypersensitivity, angiitis. It can cause a CNS agitation, anxiety, confusion, dizziness, headache, insomnia, seizure. It can cause rashes, urticaria, Stevens-Johnson syndrome if the patient is allergic to amoxicillin or beta-lactam antibiotics. It can cause dental discoloration, like the tetracyclines, but it is extremely rare to do that. It can cause diarrhea, nausea, vomiting. It can cause hematologic issues such as anemia, leukopenia, thrombocytopenia, or eosinophilia, an increase in eosinophil count. And it can cause hepatitis, increased serum ALT and AST, or cholestatic jaundice. And as we mentioned previously, it can cause anaphylaxis. But a lot of these adverse reactions are quite rare and usually are not an issue. Anyways, guys, that was a quick lesson on amoxicillin and its usage. I hope you found this video helpful. If you did, please like and subscribe for more videos like this one. And as always, thank you so much for watching and have a great day.